So let's talk about how much does it cost to get a gastric sleeve.
3, 2, 1.
Here we go!
Hi, I'm Dr. Álvarez with Endobariatric.com, and welcome to another episode of our FAQ section. Today, boy, does everybody wants to know how much does it cost to get weight loss surgery, specifically a gastric sleeve. The cost of the gastric sleeve surgery can vary depending on several factors, such as location of the surgery, the surgeon's experience, and the insurance coverage if you're trying to use your insurance for this. Also, the price will vary greatly depending on the hospital, or is it a surgical center? Here's why. And I want you to be very aware of this, because this is where the saying, you get what you pay for, comes in. Be aware that some outpatient centers can perform the surgery as an ambulatory procedure. What this means is the surgical center will perform the surgery and they're practically kicking you out the next few hours after your surgery, no matter what your recovery condition is. Usually you are staying by far less than 12 hours in that facility for the procedure like this. Believe me, it is extremely rough. It is recommended that you stay at a complete hospital setting for at least 24 hours after your surgery, since this is major surgery, even though it is performed laparoscopically. Patients at our center recover very fast. Usually patients are getting up to the bathroom 3 hours after surgery, and they're up and walking the same afternoon after their surgery. Since all our procedures are performed in the morning, early morning, to avoid the patients fasting for long periods of time. Still, they are kept in a hospital setting for the complete 24 hours under strict surveillance. And then after that, we move patients from our hospital floor, which is in the same building, to the hotel floor. And then they stay there for an extra 24 hours, and then they are discharged. So again, to try to keep costs down, some centers may cut corners by discharging you at a very, very early stage, causing the patient an uncomfortable situation, since you are not getting nothing through your IV, no IV fluids, nor medications, and you just had major surgery just a few hours ago. So let's get back to the price. We did some research, and according to some web sources, the average cost of the gastric sleeve surgery in the United States is around $20,000. But it can range between $15,000 to all the way, we found one state, all the way to $50,000. And some people may pay less or more depending on their individual circumstances. So at this point, you might be thinking, well, let me run this through my insurance company. Well, yes, it's an option. If you really have a really good policy, and you might be already aware that you will have to jump through the hoops. And of course, that costs the patient some money, a lot of time. And be aware of the copayment at the end of the road, the copayment and the insurance deductible, because, well, at the end of the day, they're going to be charged to you. Then there's Mexico. Yes, for a lot of patients, well, they opt for this scenario since we can schedule you like right away without any waiting list, without the copayment and insurance obstacles, and yes, at a much more affordable rate. But beware, there are good doctors and bad doctors in the States, but also in any other country, including Mexico. So if you opt for this option, look for credentials, seals of excellence, accreditations like being a master surgeon in this specific field, and having your surgery performed at a known center, an accredited center of excellence that has the same standards as a center of excellence in the United States. Also, be sure the surgeon has or is reputable and has a long-standing career in weight loss surgery. In Mexico, you will find prices that will be a fraction of the cost compared to the US, but I suggest you be aware and do your research thoroughly. I have a specific video talking about safety in Mexico that you might want to check out. If you are considering gastric sleeve surgery, you should consult with your doctor, your insurance company to find out your exact cost and eligibility criteria. I mean, if this is for you and your specific case. You should also be aware of the potential risks and complications of this surgery, as well as the long-term changes that you will need to make in your diet and in your lifestyle. I've said it many times, gastric sleeve surgery is not a quick fix, but is a very important procedure. It's a significant procedure that requires dedication, commitment. But if used correctly, it is a very, very powerful tool that will help you achieve great quality of life and increase your life expectancy. There you have it. I hope you found this useful. If it was, please leave me one of these since it's very useful to the YouTube algorithm. And hey, don't forget to subscribe as well. That way we can hang out again. I'm Dr. Álvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.